Hello, my name is Dr. Mohan Keshavamurthy. I am Director of Urology, Robotic Surgery and Kidney Transplant at Fortis Hospitals, Bannerghatta Road, Bangalore. Today, I would want to discuss an innovative technique that has come across for use in the Indian ecosystem for benign enlargement of prostate. There is no andropause in the male as compared to the female who has menopause. What I mean is the hormone that makes a boy a man, testosterone, continues to secrete till the last breath. Because of that, there is perpetual stimulation to the prostate gland for enlargement. The prostate gland enlarges when a person crosses 45 years of age. Occasionally, in about 3 to 4% on an annual basis, the gland which abuts or sits around the urethra blocks the flow of urine and causes symptoms such as difficulty in passing urine, need to get up at night to pass urine frequently, or incomplete evacuation of urine, or urinary tract infection, or blood in urine. Once we have done basic investigations such as PSA, ultrasound and uroflow to confirm the need for an intervention as well as to rule out cancer prostate, then usually oral medication are started. Now, because the prostate gland enlargement is starting at an earlier age group, the side effects of the medication over a prolonged period of use results in the patient unwilling to take the medication. The other problem of these medications is retrograde ejaculation. That is, the semen goes backward into the bladder and then is passed out mixed with the urine in a subsequent urinary void. Now, when you want to treat a patient who is worried about his sexual function but wants relief from enlarged prostate, conventional techniques such as transurethral resection of prostate using laser or bipolar electrical energy are difficult to convince the patient. In these instances, newer techniques are being applied for, one of which is UroLift. Now, UroLift is a technique which can be done under local anesthesia on an outpatient or a daycare basis. Occasional patients may need general anesthesia by their personal preference or by coexistent comorbidities that would need the patient to be done in the operation theatre under anesthesia. The basic technique is to put 4 rubber bands or 4 pillars to push the prostatic tissue that is compressing the urethra. 1 to 4 bands may be used, 4 being the maximum. The way it is done is to put a cystoscope or an endoscope through the urethra. There is a specific method of deploying these pillars, and we start off with 1 pillar usually on one side of the prostate. Go ahead and put a symmetric pillar on the opposite side. A 3rd and 4th pillar may be added as and when needed. The recovery of the patient is almost within 24 to 48 hours. Patient can go home same day more often than not, and occasionally the next day, and there are virtually no side effects. The most wonderful aspect of UroLift is that there is no retrograde ejaculation or interference to the sexual function of the gentleman who underwent the procedure, unlike alternative techniques, either use of oral medication or TURP. Now, in case the patient develops further obstruction 5 to 10 years down the line, you can always go ahead and do a TURP on this patient. UroLift has come as a godsend for those patients with benign enlargement of the prostate who want to preserve their ejaculatory function as well as sexual function and yet pass urine effortlessly as they did at a younger age. Fortis Hospital, Bannerghatta Road is one of the few centers in India certified to perform this procedure, and it is also the only center to have performed a 4-pillar UroLift procedure. We look forward to inquiries, concerns, questions regarding this procedure from any patient who may deserve the benefit of this innovative technique. Thank you.